Hi, Stephen Hoffman with Princeton Acupuncture and Oriental Medicine, and welcome to Acupuncture Live. So, last time I talked to you, I talked about the 7 root causes for diseases, and I promised you that I would go into each of them in depth. And that's what I want to do today. So I'm going to start with one of the most common things that I see in my clinic, and that is dental issues causing health problems. Okay, and if you come in and you're my patient, odds are good I'm going to ask you about your dental history, so come prepared. And you're probably going to ask yourself, what the heck could my teeth have to do with my back pain or my anxiety or my knee problem, so on and so forth. And what we have discovered is that there are connections between the teeth and other areas of the body. And Western medicine knows this through heart disease, okay? They've linked gum disease with heart disease. And those connections are much further reaching than just affecting the heart, okay? It can affect just about any part of the body, any system in the body. How is this? Okay, so there's 3 main dental problems that can cause diseases throughout the body. The first of those is silver or metallic colored fillings. Those fillings have mercury in them, right? And mercury is, I think, the second most toxic substance to humans on the planet. Okay, and if you have the fillings, you have them in your mouth. Okay, you have mercury in your mouth. Now, mercury generally isn't a problem unless you contact it with open skin or you come in contact with mercury vapor, right? But mercury will release vapor when you put pressure on it, okay? And what are you doing when you're chewing? You're putting pressure on over and over and over, and it's releasing a little bit of mercury vapor all the time, okay? Heat, when you heat mercury, it releases a little bit of vapor. And so if you're drinking your coffee or your tea or hot beverage, whatever it is, it's releasing a little bit of mercury vapor, and that mercury accumulates in the body. All right, the body does not have a mechanism to get rid of mercury. It has to be actively chelated in order for your body to get rid of it. So there's a lot of issues with this, right? I see a lot of thyroid patients, and when we start going down this road and I ask them if they have mercury fillings, they say, oh yeah, I have a couple of, from when I was a kid, so on and so forth. And I'm like, well, but how can that affect my thyroid? I'm like, well, the mercury's here and your thyroid is here. Okay, they're about that far apart. All right, and the blood flow that is going through that area, if it's picking up any mercury, it's going to bring it down to the heart, and the heart's going to pump it back out. It's going to go into the tissues of the body. Okay, and it causes problems. And what I have seen is that when I do treatments for the mercury, okay, to assist the body in detoxing, to assist the liver in detoxing the body, things like that, people get better. And when they go get their mercury fillings changed out for the white amalgam fillings, their problems along with the treatment will get better and better and better. Okay, so that's one issue with dental problems. Another issue with dental problems is root canals, okay? Root canals, a certain percentage of root canals go bad, and I'm going to show you a slide here. I'm going to put it down below so you can take a look at it and reference it, because it's going to be like backwards and stuff here, but I'm going to show it to you real quick nonetheless. So what that is showing is 2 teeth, okay, and this was a study done and published in the Journal of Endodontics, okay, and endodontists are root canal dentists, okay? That's what they do. And this was published in their publication. Okay, so what happened was they had a patient that they knew they were going to take 2 teeth out of, all right? So what they said is, let's do a root canal on one of them, and we'll leave the other one alone. We'll wait 150 days, and then we'll pull them out. And what they found, and if you look down below, you'll be able to see this, what they found is after 150 days, the vital tooth was 1% infected. And the non-vital tooth, the root canal tooth, was 39% infected. And that was after 150 days, all right? Some people have had root canals for years and years and years, and multiple root canals. So odds are good that there may be a problem in one or more of those teeth. So what's happening, all right? When they do the root canal, they cut off the nerve supply, they cut off the blood supply to that tooth. So the immune system can't get to those real little tubules, and you can see the tubules in the infected tooth, right? Those are all pathogens. Those dark spots are all pathogens in the tooth, and the immune system can't get to it and fight it. So it's continually dumping pathogens. Hey, Joel. It's continually dumping pathogens into the body that your body has to deal with, okay? And if your immune system has to deal with this on a daily basis over and over and over again, the immune system starts to become overreactive. The other thing that happens, if these pathogens are getting into the bloodstream, it can affect things. Where's the first stop for the blood? Back at the heart, right? So these pathogens can affect, and oftentimes they'll find the same pathogens that they find in an infected root canal tooth. They'll find it in heart valves, all right? So this is really, really serious. And a lot of times these infections can be non-symptomatic, okay? There's no symptom in the mouth, okay? But it is dumping those pathogens on a daily basis every day for years and years and years for your body to deal with. And then when your body has something challenging to deal with, it can't deal with it, all right? So root canals are the second thing that can be a problem with teeth. The third thing that can be a problem with your dental work is wisdom teeth extractions, okay? Probably 90% of my patients have had all four of their wisdom teeth taken out, okay? And again, a certain percentage of those were not done 100%, okay? It's a very, very tight area back there. It's hard to get to, and the dentist needs to, there's a ligament, okay, connecting the tooth, and that has to be completely removed. If they really do the procedure properly, they'll use ozone and or iodine to sterilize the area. And if they don't do all of these procedures, again, you can get a silent infection, okay? It's non-symptomatic in the mouth. Sometimes they are, and if it gets that bad, it's actually probably a good thing because you know about it. But most of the time they're asymptomatic, so there's nothing going on in the mouth that you know about, but it can actually get into and infect the bone, okay? And obviously when it starts infecting the bone, it is a serious, serious problem. So these are the three things that I will ask you about if you come in, because a lot of times these can be the root of whatever is going on. Especially in instances where people come in and they're like, I don't know where this came, where did this come from? I was fine, and then all of a sudden, like these crazy things, nobody can figure out what's going on with me. And what we found is if we get to the root problem, and dental is just one of them, but if we get to the root problem and get it fixed, and then get whatever imbalances that it caused treated, things get better. And not only do things get better, because I can get things better with acupuncture, I can get symptomatic things better with acupuncture, but if we don't address these root causes, it comes back, okay? So my goal is to get people 100% resolution to their problem. That's my goal, okay? And if you have an infected tooth, if you have an infected site from a wisdom tooth extraction, if you have mercury in your teeth that's dumping mercury into your bloodstream and into your tissues day in and day out, it's going to be very, very difficult for me to get you back to 100% because your body's constantly dealing with these things. All right, so if you have something that you're dealing with, you're not sure where it's coming from, and you have some of these things in your dental history, it is prudent to take a look at it. I have some very, very good dentists that I work with that will do high resolution scans. You don't have to take my word for it. Go to them. They'll do a high resolution scan. It's called a cone beam scan, and it's about 10 times the resolution of a normal x-ray. So they can see a lot more in very, very fine detail. So I have some good dentists that I can refer you to. Go get it checked out. It's not that expensive to get it checked out. And if there's a problem, you get it taken care of. And then, you know, you're not down the road 10 more years dealing with the same problem day in and day out. All right. So give us a call, set up a consultation if you want me to check any of this stuff out for you. And I'll be back next episode with the 6th most common root cause for disease. All right. Take care. Have a good day.